Hello, I'm Joshua, and I work in the emergency department at Valencia. Okay, I'm caring for a 10-year-old whose name is Pablo, who is having difficulty breathing following a bee sting. I set Pablo in his room, and I'm gonna make sure that I make the right clinical decisions about Pablo's care by recognizing and analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. All right, so I'm gonna go ahead and just go ahead and wash my hands, okay? This soap sucks. That's okay. This one's better. Alrighty, I'm gonna go ahead and go into my patient's room, okay? Can I come in?
Yes.
Alrighty. Pablo? Okay,
Yes.
I'm Joshua. I'll be your nurse today. Okay, and we have Ramon, right?
Yes.
You'll be the dad?
Yes.
Alrighty, Pablo and Ramon. Can I have your first and last name?
Pablo Handeris,
Okay. And can I have your date of birth?
2010.
Alrighty. Any allergies that I should know?
No.
Alrighty. And any pain at the moment?
No.
No.
Just a little bit.
Where you?
My face hurts.
Your face? What about your face? What parts of your face?
My tongue, my eye, my face. My whole face hurts.
You have, okay. I'm gonna go ahead and assess that in a minute. Okay, and you know where you're at?
Yes.
Where are you at?
The hospital.
Oh, okay. And you know why you're here?
Yes. I got a bee sting.
Oh, a bee sting. Okay. Hey, Dad. Has he had a bee sting before?
Yes. But never had a reaction like this.
Okay. I'm gonna go ahead and assess him and see what's going on, and then after that, we'll take some action. Is that okay?
Perfect.
All right. I'm gonna go ahead and put my gloves on. I'm gonna go ahead and raise the head of the bed just to start, okay?
Okay.
Just want to make sure your airway's patent and you're doing okay. Alrighty, I do see some lip angioedema. Okay, I do see your eyelids are kind of swollen. Okay. Can you breathe? How you feel with the breathing?
It's hard.
It's hard. All right, let me go ahead and listen to them lungs. Okay. All right. Let me see. Okay. Okay, I do feel some labored breathing. I'm gonna go ahead and also check your vitals, okay? So let me go ahead and do that real quick. Check your blood pressure. Also go ahead and check your oxygen, okay? Good. Alrighty, so I checked this oxygen and I checked his vitals as well. Also checked his temperature, okay? His temperature is 98.2. His heart rate is 128. His respiratory rate is 30. And like I mentioned before, he has some labor breathing. And his blood pressure kind of dipped a little. It's 94/56. Any lightheadedness or anything like that?
No.
Pablo? Okay. And your oxygen saturation is 89. Kind of low. So what I'm going to go ahead and do is, since you're having all the symptoms, I'm going to go ahead and talk to the provider and see what he can do for me. And for you, actually. Okay?
Okay.
And you mentioned that this is his second time he has a bee sting, right?
Yes.
Alrighty. Did you give any medication to Pablo
No.
at the hospital?
No.
Before you came to the hospital?
Nuh-uh.
You know, Dad, since this is the second time he had a bee sting, when he had it the first time, his body might have produced some antibodies against the bee venom. And since this is his second exposure, the antibodies probably triggered the release of chemicals, mediators, causing some smooth muscle contraction and some bronchoconstriction. And that's why he's having some wheezing and some difficulty breathing. Okay? So, like I said, that's why he has his face swollen. That's why he cannot breathe and stuff like that. So what we're gonna do right now, we're gonna make a solution. And like I said, I'll be back with the order that the provider has provided, and then we'll make sure you're doing okay. Okay? Before I leave, and do you need anything at the moment?
No.
Alrighty, I'll be right back. Okay? I'll give you some privacy as well. Alrighty. Ring ring.
Hello.
Alrighty, doctor.
What's up?
I'm Josh. Alrighty, I'm coming here with a 10-year-old who came with a bee sting. Okay, and I'm thinking he has some allergic reaction, some anaphylactic reaction to the bee sting. Okay, he presents with some angioedema in the eyelids, and the lips, and the tongue. He also presented with some wheezing on the upper lobes, and so bronchoconstriction, from what I heard when I listened to his lungs. His vitals, they were kind of out of whack. His temperature was good, but his pulse was 128. His respiratory rate was 30, and his blood pressure was kind of hypotensive, 94/56, and his pulse was kind of low, 89%. Right now, I put the head of the bed up, and I already talked to the dad. The dad mentioned this is his second sting, and that he, when he had the first one, he never had no reaction, so he finds it weird that he's having this reaction right now. So I just want to know what else you want me to do. I already put the head of the bed up, and I'm just waiting for some instructions.
So I'm thinking maybe some IV fluids, epinephrine for sure, and then put a non-breathing mask to get that oxygen and flowing.
Okay. Anything else that I should do?
No. Just make sure you have the head of the bed up, like you said you did that already. And then just check him after 15 minutes and just give me an update.
Okay, I'll do that. All right, thank you, doctor.
No problem.
Can I come in?
Yes.
Alrighty, I'm back, Pablo and Ramon. I have some doctor orders, alright? I'm gonna go ahead and put my gloves on, and then we'll start real quick, okay?
Okay.
There's no more. Alright, so the provider said you might have having some anaphylaxis shock due to the bee sting. So he prescribed some epinephrine.
Okay.
That's gonna go in your lateral left eye. Okay, and he also provided non-rebreather mask, so your oxygen can increase,
Mm-hmm.
so your airway is not compromised.
Okay.
And also, we're gonna initiate some IV fluids just to keep, everything hydrated and everything going. Okay.
Awesome.
So let's go ahead and do that right now. I'm gonna go ahead and expose your left leg. Okay, I'm gonna have some epi right here.
Mm-hmm.
Let's do that.
Mm-hmm.
Okay. Did that hurt? No. Oh, you're a real man. I did this stuff. All right, and then I'm gonna have the non-breather mask. Okay, good. And then I'm gonna go ahead and hang some IV fluids. Okay, so I'm gonna put them right here. Some normal fluids. Put it right there. Okay. I'm gonna go ahead. He's sitting upright. And Ramon, since I already given this medication, he should get better.
Mm-hmm.
All right, so just reassure Pablo that he will be okay.
Mm-hmm.
Pablo, you will be okay. And like I said, I'll recheck your vitals after maybe 15 minutes, and I'll reevaluate. Okay.
Okay.
Dad, any questions?
No questions.
Alrighty. So I'm gonna go ahead and let you rest, and like I mentioned, I'll be back in 15 minutes, and your blood pressure and the vitals should be back.
Thank you, nurse.
Yeah, no problem.